Hey everyone, Dr. Jeff Horowitz with Dentists in the Know. We're here at the Chicago Midwinter Dental Meeting, and we have our beautiful podcast booth, and we have some amazing friends hanging out with us. And today, someone I've known for so long in the industry, someone who has he's a mensch, another mensch from New Jersey. I'm interviewing all the mensches from New Jersey today. So
your roots go back there. What are you going to do?
Exactly,
you got to go home.
Exactly.
Everybody goes home. Isn't that Bon Jovi?
But yeah, that's right. I grew up pretty much
from
3
there,
blocks
next door
from him.
Yep.
Exactly. Anyway, Marty Jablow, Dr. Marty Jablow, all of you probably know him as the technology coach because, I've seen him at probably every meeting. No one works harder to bring great information to everyone than Dr. Marty Jablow. Practices in New Jersey. Where?
Woodbridge, New Jersey.
Woodbridge, like literally right around the corner from where I grew up. So Marty, thanks for being with us, brother.
That's good.
Reach around.
Yeah.
Can we say that?
Yes, of course, but that's not the good one.
So what's happening? Tell everyone, some of our younger listeners, tell us about your career path and how you ended up.
You really want to know
in
that
this
one.
world. How'd you end up in this world?
So let's see. So I started out at dental school like everybody else. Never expected to be doing what I do.
Yeah.
I mean, that was not even a thought process. I'm an old dinosaur at this point, or getting close to the Jurassic Park stage.
Well, you're not allowed to say your age because I think I'm very close to you.
Yes, you are.
Yeah, and that would make me also a dinosaur.
Correct. But I have the gray hair, folks. See, so the joke to that. We were doing a lecture in Atlanta for new dentists, I guess at the ADA. That's maybe 5 years ago. I'm not sure exactly. And I turned to my lecture partner, John Fluke, and I said, "You do know we've been practicing longer than these kids have been alive."
Yes.
So,
yes.
But what that does is actually give me some perspective, just like you have. Like people call it experience. Well, but this is perspective. And that perspective allows us to look back on things. So when I look back on how this evolved, people started to ask me questions. And then people then kind of kept saying, well, why don't you go give a talk? And I did. And then at that point, the internet was first starting, all right, where I was part of some very early internet dental groups and things along those lines. And with that, slowly it became, well, we can do this. And then I started lecturing with John Fluke and Paul Feuerstein. And that came out of a conversation we had in probably around early 2000. We were at a meeting in Montreal, and John said, there's not a question that one of the three of us can't answer on deck. And that was true.
That's awesome.
And it's still true 20 plus years later. And with that, that's kind of how I kind of got brought in, and then, slowly it became articles and lectures, and then I got to even the point where now, I consult on product development for various dental companies. So it's a path that kind of evolved over time, but I wouldn't say that it's a path that somebody should necessarily go, I want to do that. Yeah. As you well know, because you've been out on the road a long time too, you make a lot of sacrifices for that.
Absolutely.
Time in your house, time away from your family. So when you get into this, at that point, I know I didn't know I was getting into, but
none of us do.
Yeah, but you have to really think about what that is before anybody wants to do what we do.
Yeah,
it's not as simple as it looks.
Well, and I also think everybody looks at it as a form of celebrity, which, of course, outside of the dental world, nobody knows who the frig we are.
So
my
daughter would say to me, "Dad, you may be famous in the dental world, but in the real world, no one cares."
No one cares. And I always say that like John Coyce walking around a dental floor, he's flooded. Everybody's like, oh my God, there's John Coyce, right? No.
Right.
Anywhere else where there's not a dentist?
Who's he?
Who gives a you-know-what?
Yeah, absolutely. And that goes for Gordon Christensen.
Absolutely.
It goes for Frank Spear. It goes for... Listen, in the end of the day, all right, we are not A-list celebrities.
No.
All right?
No.
And nor do I want to be one.
Yeah.
But that's the kind of thing it is. We're people. We're
Although
just
they
the
treat
same
me
thing.
like one at the Motel 6. Yeah.
At least I know. I stay at a Marriott, so I'm better off than you. But that's really the thing, is we're still all just people. And I've said, I did a podcast at the ADA where we were talking about pros and cons of the ADA. And one of the things that I don't like is dividing dentists.
Our profession has been doing that for a long time.
Right. I don't like whatever group you want to associate with. I'm fine with that. But in the end, we're all dentists and we all treat patients.
Right.
And that's it. I don't. When someone sits in my chair, they're patient.
That's it.
That's it. I don't look at the race, religion, politics. None of that matters. You got a problem, I got to solve it.
Right.
That's it. And the rest of it is superfluous.
Yeah.
But some people think it's important these days.
Yeah. Well, I mean, it is an important role, but it's one of many important roles out there. We just, and I think that's something that we've tried to do with Dentists in the Know, which is maintain a sense of humility. We just want to be those regular people having regular conversations and talk about everything that we screw up. And I got a lot of years of those.
So do I. I tell that to my associate.
Yeah.
That's part of mentoring.
Right.
All right? When they look at something and they don't know, well, I already made that mistake.
Yeah.
Probably 1, 2, 3, 4. Could be a lot of times before I figured out what the solution is. The idea is to impart that knowledge to those others who then can, get it. And then, so I stole this line. You'll like this one. So before I ever thought about being a dentist, there was a guy named Bob Barkley, right?
I remember him well.
Okay. And he had a thing where the idea is that dentists are supposed to make the patient, I'm trying to remember now. Dentists are supposed to make the patient worse at the slowest possible rate. Okay? I've added to that. And what it is my job is to do with what I have today to maintain their dentition and everything else, so that I can hand it off to someone else who will have better materials, better techniques, and other things to be able to take what I have and use it. Yeah. So that guy that did a lousy endo 30 years ago, but it somehow stayed in that patient's mouth till they fractured the tooth.
Right.
And now I can put an implant in. And someday somebody will regrow that tooth. I know that now. But that's the point. And that's what really dentistry is about, is just taking good care of a patient and knowing that somewhere down the line, they're not going to be your patient because you're not going to be doing it.
Of course not.
And the things that you did well and allowed them to keep their dentition will allow them to continue to be able to function in ways that you and I don't even know.
It's an interesting perspective because, one of the things that's most important to me, and a lot of this comes from, the training at Coyce and risk assessment, but that was a very powerful point in my career where I started, it's a paradigm shift. I started to look at dentistry very different. Before it was my job is to fix you, right? Mm-hmm. That's how I viewed myself as a dentist. Now the first thing I say to a patient is, my job is not to figure out what's wrong here. My job is to figure out how it went wrong and then figure out a way to keep you out of this chair as much as possible. Find a solution that keeps you from having that same problem over and over and over again. And it's not about which material or which procedure or whose occlusal camp I'm following, It's really just more about, how do I keep this patient as healthy for as long as possible? So I learned early in my career as well that cockiness and dentistry don't fit in the same room ever. And it was a young girl for me that still haunts me to this day. I still have to see her when I go pick up a pizza. Because, she now, she's married now, she owns a pizzeria with her husband, and they make great pizza, and I still have to see this young lady.
You have great pizza in South Carolina?
Believe it or not, yes. It was a guy from New Jersey that started this pizza place, and he handed down the recipe. So luckily they kept everything the same. But yeah, I get it. But what I was saying is that cockiness and dentistry don't fit in the same room, and it's something I learned really early, And I show this one same case in every lecture I do. And I do it as much for me as I do for the audience, because it was a young woman. I was doing a lot of ortho, thought I was really slick, could handle anything, missed a joint problem, missed an airway problem on her. Case carried on 4.5 years. She really ended up needing joint surgery, which is what happened. But, you know, I had to have that conversation with the parent that
Right.
I didn't catch a few things, and here's where we need to go. And luckily I didn't get sued, but I really deserved to.
Well, you may have thought you deserved to,
Yeah,
but
yeah.
that doesn't mean you did.
Yeah.
And an example that I always use is this, and it's an ortho case. It was a woman probably in her mid to late 20s comes in, and I look at this case, and I'm looking, and I'm going, she had some retained primary teeth, but I'm looking at it going, botched ortho. Something botched here. So I call the orthodontist, and he says to me, let's go to lunch. I want to show you this case. And he pulls out the models from where he started. And where did she wind up? Well, I went from botched ortho case to, you did a great job. All right?
Yeah.
Now we're 10 or 15 years post ortho, and we've got a better set of solutions. All right. So he redid some of her ortho. We extracted some of her retained primary teeth, placed implants, placed composite onlays in tooth, and all of a sudden her entire smile changed for the better.
Yeah.
So it goes back to what I said before. You know, time gives us better techniques, better materials, hopefully, and better perspective,
Yes.
so that we can see that we can do better. Doesn't mean I could have done better then. You might not have done it. That doesn't mean she wouldn't have had to have joint surgery.
Oh,
either.
no. I don't think I'm the reason she
Right.
needed joint
So
surgery.
that's
but
what I'm saying.
I was just mad at myself for not
not
catching
seeing it.
something that stands out so obviously to me now.
Right. But that's the thing. We evolve.
Yeah. Well,
Okay.
and that's a great point, and it's also a great segue, because, you know, we've talked about everything. What we haven't talked about is the thing that you're so well known for, which is, you know, having a great perspective on technologies and the trends
Right.
that are going on in dentistry. So I'm just going to lob that grapefruit over the plate and say, tell us what's going on in technology, and what are your perspectives?
So everything's digital. Let's face it. At this point, the greatest.
It's all ball bearings these days.
Yes. the greatest adoption has been scanning. It's happened much faster than digital radiography did. Cone beam, it's just exploding. And some of the things I'm seeing, we're over 50% of the dentists are scanning now. And with that, I tell a quick story of probably about 4 or 5 years ago, when I only had one scanner. We now have multiple scanners. But when we had one scanner, my assistant dropped it and broke it. And I had to go back to taking real analog impressions, which I did for most of my career.
Right.
And wow,
How painful.
And that was so stressful.
Yeah.
So what we look at now was what I call the possible now has been done, and the impossible will be done. So what I couldn't do 10 years ago, 15 years ago, is now possible.
Yeah.
And it has become routine. So the thing is that technology continues to advance and evolve and makes difficult things easier. Taking an impression. Here, a perfect example. Way back when, patient comes in and says, I want the denture exactly as it was in an analog world with new teeth. It doesn't happen.
Right.
All right? Now, it's easy. I can scan the denture. I just had a patient who, patient's husband comes in and said she finally broke that temp. 8 years she wore the temp. And I had delivered a final prosthesis, a lower denture. And she comes in with the lower denture, and it's got perfect occlusion. And what happens then is, I said to her, you can wear this. And he said, but if you don't like it and you're not happy and we can't get you come, I'll scan that old one that's a little broken, and we'll put it right back in your mouth, because it's the closest thing I can make. I couldn't do that.
It's
ever.
amazing, isn't it?
So now I could actually make an exact duplicate of a denture, good or bad, and that's it.
Yeah.
And that's the stuff that was not possible.
Yeah.
You know, some of the implant stuff, when you look at it now, guided surgery, printing, all on X's in your office to deliver that same day.
It's something you never could have imagined
Never,
20 years ago.
ever could have imagined doing that because it just was so outside the norm. I mean, I remember the first implants we did, and I knew every case, and I knew all about it because it was a big deal. We didn't even have, locks. It was just a screw in a cylinder.
Yeah.
So you had to make sure it was anti-rotational, all this stuff.
Shock absorbers, remember those?
So the windup was that we now, it's a routine part of dentistry, so things evolve.
Yeah.
What's the things that are going to evolve further? Well, I think right now is obviously more of this digital workflow. I think it's important. I think it's there. Printing, it still has a long way to go to evolve.
Yeah.
In many cases you get a product, but you might get an inferior product. It's not the product that the lab can deliver.
Yeah.
Is that good or bad? It depends how you look at it. But with that, I think we're going to eventually get to a point where we're not doing all this post-processing. And we don't have to do these resin printers.
That's the pain point.
Yeah. I mean, if you look at other printers, PLA and stuff like that, where you print it, you take the things off, and you're pretty much done, we'll get there. We're just not there yet.
Yeah.
And what we're seeing now is an evolution inside of printing because there's parts that companies are trying to take care of those pain points. Whether it's design, whether it's printing, whether they're trying to figure all of that out and become solutions, digital solutions that we need. So that's in an evolution process, but when we look at it, we've come through the bleeding edge, and now we're getting towards the mainstream, but I think that curve has a long, flat top on it till we get to the other side. And I think that's a really big piece of it. Yeah. And with that, to me, that's the future. Where does it go? I have some ideas, but
I don't think any of us know at this point.
Yeah, we don't know exactly, but we have an idea where it's going, and it's got to become simpler. Yeah. That's really what it comes down to.
Well, real quick, because we are out of time.
Yep.
And you and I could do this for 3 hours, probably more. We could probably stand on a stage and do this for 3 days.
Yes.
Best piece of technology you have seen this year, or most interesting? I shouldn't say best.
Most interesting piece of technology.
All right, I'm going to tell you what. We're going to have you on a live Wednesday show.
Yeah, I'm going to have to answer that.
You're going to have to answer that. But thank you so much for coming and talking
always a pleasure
with us,
talking to you.
Thanks for being a friend of Dentist in the Know, and thanks for everything you've done for dentistry.
Thank you very much for having me. Appreciate the accolades, but you know what? It's not necessary because I do this because I enjoy it and I want to give back.
Love it.
That's really what it's all about. And cheers to everybody out there and have a good day. We don't have the drinks with us. So.
No, not yet, but that'll happen soon. The technology coach, Dr. Marty Jablow.